Hello everyone, my name is Griselda Hasso, and for my disease report, I will be going over Hib. A few characteristics of Hib. Hib is short for Haemophilus influenzae type B. Hib is an encapsulated immotile, non-spore-forming gram-negative coccobacillus. Its genus is Haemophilus, species is H. influenzae, its serotype is B, and of course it is commonly called Hib. So what is Hib? Despite its name, it is not the same as influenza or the flu. However, Hib was found in a group of patients during an influenza outbreak in 1892 by German physician and bacteriologist Richard Pfeiffer. It was thought to cause the flu until 1933, when influenza was attributed to a virus and not a bacteria. In 1930, two major categories of H. influenzae were defined: the unencapsulated strains and the encapsulated strains. The encapsulated strains include 6 types, A through F. Hib is an encapsulated strain, and it is type B. Hib is a bacteria which causes mild to serious, often life-threatening diseases. A mild disease brought upon by Hib would be an ear infection. However, Hib can bring about invasive diseases that can prove to be very lethal, such as meningitis, pneumonia, which is a lung infection, epiglottis, which is distinctive in the swelling of the throat, cellulitis, which is a skin infection, infectious arthritis, which brings about joint inflammation, and bloodstream infection. Transmission. Humans are the only known reservoir for Hib. It can spread through contact with mucus or droplets from the nose and throat of an infected person, through coughing, sneezing, or any event or activity that involves the sharing of mucus or saliva. People who are not sick but have the bacteria in their noses and throats can still spread the bacteria. This is actually how H. influenza spreads most of the time. Pathogenesis. Once Hib is contracted from an already infected person by mucus or saliva, it enters the body through the nasopharynx. Hib has a PRP polysaccharide capsule that is a major virulence factor. The PRP capsule protects the bacteria from phagocytosis and facilitates penetration to the bloodstream and the cerebrospinal fluid. Invasive diseases arise when the bacteria invade parts of the body that are not normally inhabited by germs. The incubation period of Hib is 2 to 4 days. Common symptoms include fever, lethargy, cough, muscle pain, and headache. A plethora of other symptoms can also arise, but vary depending on the illness caused and the part of the body that is affected. The more serious illnesses brought upon by Hib result in complications. These complications vary depending on the type of Hib infection, but can include neurologic damage, blindness, deafness, and even death. We understand how common symptoms arise, or how they look, but I wanted to focus more on the serious symptoms brought upon by a Hib infection. In this patient, we see severe swelling on the face due to a Hib infection. In the toddler arm, we see a skin infection caused by cellulitis. In this patient, we see severe throat swelling caused by epiglottis. Epiglottis and cellulitis are, of course, caused or brought upon by Hib. Doctors typically conduct a physical exam or look at symptoms in order to diagnose Hib. They might take a small sample of blood, spinal fluid, or another body fluid for testing. Antibiotics are often used or are used to treat serious infections. With the serious infections, hospitalization and other medications are also needed. Prevention. In order to prevent Hib, vaccination is crucial. An effective and safe vaccine against Hib has been available since December of 1987. With the vaccine, the number of new cases of Hib, a disease in infants and young children, has drastically decreased by 99%. With the vaccine, it is a series of 3 or 4 shots that's usually given to babies. For all Hib vaccines, the first dose is recommended at 2 months of age. followed by 4 months of age, then 6 months of age, then 12 to 15 months of age. Generally, the vaccine is not recommended beyond 5 years of age because by that point, the child is immune. Furthermore, antibiotics can also be used in some circumstances as preventative treatment for those who have been exposed to Hib. Immune response. Before vaccines, passive protection of some infants was provided by the mother through transplacentally acquired maternal IgG antibodies and through breastfeeding during the first 6 months of life. Immunity could also rise naturally with increasing age through asymptomatic infection in Hib bacteria. With the development of the vaccine, however, a more readily way to combat Hib was now available to the community. Effective Hib vaccines have been designed by covalently linking the PRP capsule to a carrier protein that recruits T cell help for the polysaccharide immune response and induce anti-PRP antibody production. Incidence and prevalence. Hib occurs worldwide. Before there was a vaccine, it was once the leading cause of bacterial meningitis among children less than 5 years of age. Vaccination against Hib has drastically reduced the rate of invasive Hib disease in young children. The populations that are still susceptible or at risk include the elderly, unvaccinated or incompletely vaccinated children, and people with a weak immune system. In developing countries where routine vaccination with Hib vaccine is not widely available, Hib remains a major cause of lower respiratory tract infections in infants and children. With these infographics provided by the World Health Organization, we can see that pattern exactly. Hib incidence rate per 100,000 children under the age of 5, we can see a lower incidence rate in developed countries. But as we move to developing countries, we see a higher incidence rate. We can see that similar pattern in the Hib death rate per 100,000 children under the age of 5. When we go over the more developed countries, the death rate is significantly lower to less developed countries. And of course, this is attributed to immunization that is readily available and highly encouraged in developed countries, whereas in developing countries, the access to vaccines and the encouragement for immunization is not available to them. Furthermore, the treatments for the complications that arise from Hib are also scarce and not available to the community. And that, of course, leads to these patterns where we see more deaths and more incidents in underdeveloped countries compared to industrialized or developed countries. Outbreaks. H. influenzae outbreaks were once linked to the influenza outbreaks in the 1890s. That was, of course, before influenza was attributed to a virus rather than a bacteria. Now we can say with certainty that H. influenzae was a cause of secondary infection in those outbreaks and not the direct cause of those outbreaks, because the patients that typically suffered from influenza were susceptible to bacterial infection by H. influenzae. Due to the high level of immunization in developed countries, especially the US, we don't see a lot of outbreaks of Hib because babies will be vaccinated very young and be immune by the time they are able to go to school. So there was one small outbreak in 2009 in Minnesota where a 5-month-old child who was incompletely vaccinated did die due to Hib meningitis. And of course, it spread to 4 others who were severely sick but were able to recover. This goes to show that vaccination is crucial. Even though we are in a highly developed society where vaccines are available to us and encouraged, the vaccine for Hib does take a while, and it takes a couple of doses, and thus it is important for everyone to complete their vaccinations in order to be fully immune to Hib, as well as being precautious with how they interact with the world, especially if they are not vaccinated, as they can lead to spreading the bacteria to susceptible groups. Thank you so much for your undivided attention, and these are my references.